Hello everyone, welcome to this week's edition of Man to Man. I'm your host, Hugo de Batika. Delighted to have you coming along. Important conversation. As always, today we're discussing men's sexual health. With me in the studio, I have Dr. Alan Chiura and Dr. Lawrence Matanike. Gentlemen, very good day. Thanks so much for coming onto the show.
Thank you, Hugo. Thanks for having us.
Dr. Chiura, allow me to start off with you. Men's sexual health is a complex subject matter, right? What are some of the most common visits that you get from some of your patients?
Yeah, probably in our private practice setting, the most common one is middle-aged gentleman who was previously having fairly good erections and they're starting to wane. So now he doesn't have those early morning erections anymore. He doesn't get the nighttime ones anymore. And even when he wants to have sex, he may not be able to maintain it for that long. That's probably the most common.
So coming back to that issue, that you most commonly come across patients that come to see you?
Well, in the in the public sector, where I work at Perinatal Hospital, it's quite similar to that, but we do get much less of the erectile dysfunction problems, but more of issues to do with men who's having difficulties to pass urine or passing urine with blood and so on and so forth, but not necessarily, not commonly to do with erectile dysfunction.
Is there a reason, do you think, socially, that the visits in the public sector speak to more illness, for want of a better description, right, versus the visits that you get in the private practice?
No, I think the private practice patients are, I think they're more in tune with their own health. And so the client I'm talking to you about is typically a client that probably already has high blood pressure or diabetes. They've got some what we call pre-morbid conditions that will basically predispose them to erectile dysfunction. Whereas when the general talk in the public space about erectile dysfunction typically is amongst a younger generation of men, rather than the type of people that come and see us. So it's very rare for us to see a 35-year-old coming to us and talking about erectile dysfunction, but yet it's common to see a 35-year-old on the street buying those drugs at Matanike saying that these for erections. You know, there's enhancing, the whole idea of enhancing versus somebody who's got a disability and an inability to actually get an erection. Very different.
So let's break that down.
Yeah.
I think that's going to be a key part of this conversation. Right. What are the most common causes of erectile dysfunction and how do you treat it?
Right. So I would say if you were to look at a broad spectrum of patients with erectile dysfunction of all ages, you'd probably find that the number one cause of it is actually stress. You know, anyone who's stressed about whether it be money, marital relationships, children, the last thing they're going to be able to do is have a good solid erection because their stress will pretty much eliminate that. The second for us is that a lot of our patients are coming in, like I said, they have these other conditions such as high blood pressure, diabetes, which predispose them to the erectile dysfunction. So typically if I've got and I see this from time to time, 25-year-old patient comes in and says, "Doc, I'm having trouble with my erections." And I take a normal history like I normally would. They have no other medical problems at all. And if you were to do this to this patient, give him a medication that we typically give for somebody with erectile dysfunction, and you tell them to take it once, the first time they want to try. They'll take it the first time. The second time they'll take it. The third time they'll forget to take it, and they'll have a perfectly good erection. The fourth time they'll be perfectly fine, and they'll realize that they didn't need it in the first place. So it's the idea of feeling like you've taken something that's going to not fail you. And that's the sort of 30% placebo effect that we talk about. And that's very typical of young people. Yeah. Whereas in the older people who have a genuine blood flow problem or a neurological problem, that's a very different scenario.
Dr. Matanike, how do you ordinarily treat some of these cases of individuals that are visiting and say, "Doc, I can't get an erection, or I'm not getting erection as frequently as I'd want?
Okay, so the commonest cause being psychological, it would be important to delve into that primarily. And then also order investigations to do with other causes. Because we can't just say, no, this is psychological, and sometimes it might not be. So you need to order investigations, blood tests, and imaging, and so on.
And most common causes outside of that which is psychological, as you've indicated.
Right.
So when it comes to physical, when you talk about the anatomy and things actually going wrong with a man's body, what are some of those challenges?
Yeah, the most common one are the ones I mentioned already. You know, high blood pressure is a big, huge problem that we face here. So you've got a medical problem that's causing high blood pressure. And how do we treat it? We treat it with antihypertensives or drugs that will lower the blood pressure. You know, if you look and do a comparative estimation of the size of the arteries that go to the heart, and then you look at the size of the artery or the blood vessel that goes to the penis, the size of the blood vessel that goes to the penis is tiny. And if they're already having heart issues, you can only imagine what's happening in the much smaller blood vessel. It's just obviously not getting enough blood flow. So that's a very, very big cause for us. Patients with diabetes, you know, they form these, they're predisposed to forming what they call atherosclerotic plaques, or, you know, their blood vessels start to get narrower. And these are the things that will also cause them to have heart attacks, strokes, but also erectile dysfunction.
I'm a little stumped.
Yep.
Because obviously these multiple conversations that are happening on in many platforms. Right. Now, at what point do you prescribe Viagra or similar to that effect?
So I'll leave that to Dr. Matanike. Like I said to you, Dr. Matanike is a general practitioner first, before he decided to come and become a urologist. And so when a patient first has these things, their first point of contact is their general practitioner. So it'll be interesting to hear what he has to say.
So yes, with patients who present with particularly psychogenic or psychological, it's important to address those issues first. So we are not too quick or too fast to then say we want to prescribe these enhancing, these stimulants, erectile stimulation medications. So when it becomes really appropriate, it is after ruling out a lot of the other issues, because it goes in stages, whereby if somebody is not having a good erection, and if you notice that there's a physical or a medical cause for this, it's not psychological, you might want to start with the medication, and thereafter, because eventually this medication, depending on the primary cause, they may eventually fail. So you would have to have a plan to say, when they fail, what am I going to do next? So it's a stepwise sort of assessment.
Our conversation today is around men's sexual health. A lot more to look forward to when we come back. Don't go away. Thank you for staying with us. You watching Man to Man, incredible conversation I'm having with Dr. Chiura and Dr. Matanike. Now, I also want us to debunk certain myths, if you will. I want to talk a little bit about male infertility. You know, questions on why we don't get pregnant, how much of it is the problem with the man, can tight underwear cause problems in your fertility, cycling, or the heating of the sperm. I know it's a bit of a mouthful, but you know those are some of the issues around male infertility. Your comments on the most common causes?
I think the most common cause is we don't know. That's the most common cause. But we do know that in an infertile couple, half the problem is a male problem. Okay. And when we investigate those men, there's only one thing that we as urologists can correct. There's something called a varicocele. And so just to break down sort of normal physiology, we know that the testicles live outside the body because in order for spermatogenesis or the making of sperm to occur, it has to occur at an optimum level that is 1 degree lower body temperature than normal. And so that's why the testicles live outside the body. And so anything that causes an increase in the temperature of the testicle potentially can affect spermatogenesis. So what are those things? One of the most common ones is this thing called varicocele. In the same way that you see some women will get veins that are big dilated veins in their legs, you can have those sort of same dilated veins in the scrotum. And that's typically caused by faulty valves in the veins themselves. And those will increase the temperature of the testicle and cause infertility. And that's the one that we correct most as urologists. But then there are patients who have what we just call primary testicular failure, where for whatever reason it is, whether it's an environmental toxin that affected the testis, whether it's a previous viral infection that affected the testis. There are other causes that we don't really know what they are that can affect the testis, where the testis no longer actually makes sperm. And that does happen.
Dr. Matanike, issue around tight underwear, cycling, etc. Are those contributing factors?
Yes, absolutely, because when the testicles remain up, they tend to be exposed to the normal body temperature, but they should be at a degree Celsius lower than the normal body temperature. So yes, that contributes. So just to comment on the other issue about undescended testicles being a cause for poor fertility, is the fact that when we as urologists intervene early, particularly within 6 to 12 months, at most maybe 18 months, but between 6 to 12 months, when we intervene, when this male patient is still a baby, and then we do the operation to bring down the testicles, there's a chance that we may preserve the fertility of that male patient.
So one of the things that we talked about a little while ago was demystifying some of the myths that exist, true or false, I suppose. And one of those issues that men talk about is that they struggle to get an erection, or struggle to have regular sex, but when they go out to their respective partners or extramarital relations, they don't face that problem. Dr. Chiura, is that mental or is it a physical?
Yeah, I mean, the reality is that when they have been in a monogamous affair where this partner has been their single partner for that long, anything that's outside of that is a novelty. And in the same way that we will be driving a particular car, and then you look over there and you see a flashing new car, that flashing new car is attractive, right? It's no different. And so you have to find ways to make what you have in your relationship as exciting as possible. And that requires a conversation between the partners. And I think if the partners are open and they can have open discussions about their needs and are their needs being met, I think they can arrive at a very happy place.
So where does one get that information ordinarily? I mean, what are the safe spaces to find that information to enhance your sexual experience with your partner? Because I'd imagine that there's a lot of lucid stuff out there, but there's also some good stuff.
And you know, lucid is everyone's. Not everybody agrees on what's lucid and what isn't. Yeah, we all have different tastes, and we all have different ideas of what a good sexual experience may be, and we all have sexual fantasies, men and women. I think there's this assumption that women don't have sexual fantasies, yet they do. And so it's about having open conversations about what is it that you would like this relationship to look like, and how do we get to that place, and be mutually satisfied. And I think a lot of guys would find that is actually more exciting than going outside. because you're enhancing what you already have.
Dr. Matanike, I want to talk about what's taboo and what isn't, and how do couples, because you're not a counselor by any stretch of the imagination, I think, but I think based on your experience as a general practitioner and obviously speaking to men and at some point couples, how do you manage those conversations? Because a lot of the time women are said to introduce stuff that they've learned or seen at a women's event, for instance, and the man says, how did you learn this, or how did you do this, and it becomes a problem. So they're reluctant to have those conversations. And the same may be for men. So how do you create a safe space where you can have those conversations?
Well, it's a very difficult conversation to initiate. Seeing as currently women, it's unfortunate, but women, they tend to be expected to have a certain role where they're submissive and they cannot express their fantasies. Whilst yes, they do have their fantasies. And when they meet at some local functions, the get-togethers, the kitchen parties, and so on and so forth, they tend to hear some conversations about how to spice up things. They get excited, but unfortunately, sometimes they cannot express those desires or those fantasies to their partner. So, me not being a trained counselor, it's very difficult to delve into into such conversations.
Dr. Chiura, your 2 cents worth?
No, I 100% agree with him. What we don't have in this country, as far as I know, are sex therapists. And, that would be the place to go as a couple. So, whenever I have the opportunity to have a couple in a room that are seeing me as a consultation, I try to address both sides of the story. And that's oftentimes the best way to do it when they're both in the room. But unfortunately, a lot of times when guys come to see us, they're coming to see us for whatever urinary problem. And it's by the by, I'm having difficulty with erections. And so the spouse isn't there. But ideally, it would be nice to have the spouse come in and actually have an honest and frank conversation about what it is. You may find that the guy actually does not have erectile dysfunction, but that the wife is having vaginal dryness and doesn't want to have sex because it's sore. And so if that were treated, then that might solve their problem.
So I look forward to talk about, but when we come back, I'd like to get some insights into some of those issues that you are continually dealing with, some of the issues that may not necessarily be on the radar of most men. You're watching Man to Man. We're back in a moment. Thank you for staying with us. Men's sexual health. Big conversation, much to unpack as we carry on with my esteemed guests. Gentlemen, I want to focus a little bit on the role that men play once they, as a couple, become pregnant. So the wife is expectant. Can you have sex with your wife till the day before she delivers? What are the expectations? I mean, socially, so a lot of challenges. What can men do once that baby's arrived?
No, just to answer the one about can you have sex with a pregnant woman, the answer is yes. You can safely have sex with a pregnant woman. Oftentimes there's fears that, by having sex you're gonna trigger the birth of this child, and that's not true. So that is safe, especially up until sort of the second trimester. Once you're getting close to delivery dates, there may be some debate as to whether or not that may still be valid. But the fact that a couple is pregnant is an exciting time. They're bringing a new human being into this world. And as a couple, ideally, each has a role. and a very important role. And I think the thing I'd like to stress more than anything else is that the father is not an accessory. The father has a very important role to play from the time that this baby is born all the way through development. And there are fantastic studies to show that fathers who are more involved with their children from the beginning actually have a much better relationship with their children in adulthood. And their children make very good choices of their own life partners on the basis of that experience. And a lot of it has to do with the dad. So you'll find that dads who are absent, those children will struggle later on in life. So the role of the father is really critical.
Dr. Matanike, to pick up on that, right? Dr. Chiura just talked about you can have sex pretty much into just before delivery. But there's also a period where you can't have sex with your wife. I mean, once you've given birth, I think you've got to wait several weeks. It raises the question around the men's sexual cycle. How long can a man go without sex? Or how do you manage that process?
The commonest cancers affecting men, it is generally, it comes generally with age, right? There are certain families or certain groups of people or that have a genetic predisposition to developing prostate cancer, and also there are certain races that have a higher risk of developing prostate cancer, particularly black men. It tends to be lower in Caucasians and lower even in Asian men, but highest in black men. And also, it's important to note that in those black men, it tends to be more aggressive than in the other groups. Yeah, I don't know if you want to that.
I think that's fair. So, as you said, it's a disease of aging men. Typically, we start screening black men from ages of 40 and above. Or if they're Caucasian, if they've got a family history of prostate cancer in their family, then they need to go and start getting screened. So what is screening? Screening is when you're looking at the general population to pick up a disease early. Mm. And so in our population, what we generally recommend is that if you can see your general practitioner once a year, get a simple blood test called a PSA, a prostate specific antigen test. It's just a simple blood test. Get that done once a year. See your GP, have a rectal exam done, which is 10, 15 seconds, where they're feeling to see is their prostate feeling normal? Are there any abnormalities within the prostate? And if you just do those two things once a year, that's adequate screening. You're going to pick up cancers early. The goal is to pick up cancers early. The problem that people don't understand is that prostate cancer has no symptoms. There are none. Absolutely none. And I'm going to divulge a little bit here. Mm. I had prostate cancer myself last year. Wow. I had no symptoms. None.
Were you screened?
I had been screened for the last 10 years because my father had it. And so therefore I knew I was at risk. And because I knew I was at risk, I was getting screened on a yearly basis and we picked it up. So the key is to catch it early, then treat it, and you're done. And you move on.
So even a neurologist
Even a urologist can get it. Yeah. Yeah.
Interesting. All right, so as we wrap, just one word of advice from the both of you to hundreds of thousands of men that are watching the show, essentially the women who obviously might be watching and relaying the information to their partners. Dr. Matanike, I'll start with you.
Yes, in terms of prostate cancer, it's important to, especially in black men, to start to go for a digital rectal examination from the ages 45, 50 years thereabouts, and onwards, probably once a year, and get a PSA blood test done. But probably earlier in those who have a family history of prostate cancer. It's very important that when it's caught early, then it's amenable to treatment. Yeah.
Dr. Chiura, to wrap.
There's a lot of people that will not come in to get screened or tested for prostate cancer because they fear that this is going to put an end to their sex life. Yeah. And the reality is that with the treatments that we have available to us, and with medicine being medicine, there are things we can do to help with sexual function when somebody has had a side effect from their prostate cancer treatment. The primary goal is to keep these people alive, cancer-free. And if, as a result of it, we get a complication that results in erectile dysfunction, there are things we can do to restore those. So people need to know that it's not the end of their sex lives when that happens.
Promise this is the last question. When does one's sex life?
It never ends. And I would like you to define sex.
In the context of
Intercourse?
intercourse?
Yeah. Is that what you mean?
Yeah.
Okay. Intercourse, as long as a man can get an erection, they can have intercourse. I've got 95-year-olds who are still having intercourse.
I suppose it is on that note that we're going to end the show. Gentlemen, it's been great having you on Man to Man. Dr. Matanike, Dr. Chiura, thank you so much for your time.
It's a
Thank
pleasure.
you. Pleasure.
Many of your questions answered, many demystified. We're back again at the very same time next week. Remember, you can catch us on 3K TV every Wednesday at 8:30 p.m. You can also watch us on Man to Man Global on YouTube. I'm Hugo Batika. Remember, we leave no man behind. Goodbye.